It is a cruel irony that the gift of one life can potentially bring about the loss of another. Tracy Smith has our report on the debilitating effects of postpartum depression and news of a promising new treatment.
This is all of us when we were younger.
High school sweethearts Mitchell and Brenda Encarnacion filled the early years of their marriage with excitement.
So Ireland, Italy, you guys went everywhere.
Mm-hmm.
Before embarking on another kind of adventure.
How was she about looking forward to having the baby?
Oh, she was super gung-ho, just reading all these books. There's like YouTube videos. She made me like a PowerPoint.
So she watched all these parenting videos.
It was like a full-time job for her.
She's hungry.
In October 2020, Brenda gave birth to their daughter Evelyn. Yet, despite all their preparation, there was one thing they didn't see coming.
Sometimes I'd catch her just like crying for no reason. And I would always ask her and she'd be like, yeah, it's just hormones. And she just kept calling it mommy brain.
As a paramedic, Mitchell said he recognized the signs of postpartum depression and begged her to see a therapist. But things didn't improve.
Was there a point when you knew something was wrong?
The morning before, she looked different. I could see it in her eyes, there was something wrong.
That day, 9 months after giving birth, Brenda Encarnacion took her own life. She was 30 years old. In the United States, 1 in 7 women experience postpartum depression. More new moms die from suicide or overdose than anything else.
Their main complaint is, I'm feeling overwhelmed. And that should really be a signal for us to dive deeper.
Dr. Christina Delagenidis is the director of women's behavioral health at New York's Zucker Hillside Hospital.
Feeling overwhelmed, feeling consumed.
She researches and treats depression in pregnant and postpartum women.
There is this phrase out there, the baby blues, which makes it sound like it's just normal and it will go away.
This is not the baby blues, right? So they both exist, and that's part of the confusion. So the baby blues are really this normal physiological adaptation to delivering a baby. And so our brain needs to reset. And sometimes that can affect our mood. And it never lasts more than 2 weeks. Does not require any treatment at all.
Postpartum or perinatal depression does not go away after 2 weeks, and the symptoms are often more severe than feeling a little sad.
Many women will withdraw from the things that they used to enjoy. They'll also report just feeling drained of energy.
PPD is triggered by factors like genetics, stress, and changing hormones. Dr. Delagenidis says you can actually see it when looking at the brain.
This area, the medial prefrontal cortex, really important for emotion regulation, cognition, and this is the area that we're finding really has much more activity, more fired up in postpartum depression than in women without any symptoms at all. It just makes it so real, and it dispels the stigma that this isn't a true medical illness.
You can see it is.
Exactly.
The turtle. Do you see the turtle on there?
Lisette Lopez Rose didn't need a brain scan to tell her something was wrong.
I like to use the analogy of like shells. So like a crab shell, I felt like the meat is the baby. It was picked out and then I'm just discarded. That's really how I felt.
In the months after she gave birth to daughter Sybil in November 2020, she began to have suicidal thoughts, but her doctors never knew.
Everything's about the baby, and it's never about the mom. It's never about like, how am I doing? So I never had a conversation. I think if I did, I might have been a little bit more truthful.
Was there a part of you that was scared to say, hey, I'm not fine?
Yes, I'm a woman of color. I'm Latina. If I say something that like, I want to take my life or something like that, I feel like they would have taken my baby away. Like that was my mentality. And that's why I was not honest about like disclosing how those thoughts were affecting me.
6. Yep.
Lisette eventually found help and now shares her journey on social media, hoping to destigmatize PPD. But experts say only about 6% of diagnosed women receive treatment, and thousands more never come forward at all.
I think we're likely underestimating the population that's suffering.
Joy Burkhardt is the executive director of the Policy Center for Maternal Mental Health.
Why are so many women falling through the cracks?
Here in the United States, our system doesn't hold any one provider responsible for maternal mental health disorders. The problem really lies in accountability. Who's responsible for detecting and developing some treatment plans to support women?
And right now you have the woman being passed from one provider to another provider.
Indeed.
Traditional treatments like antidepressants take time, something new moms don't really have. But starting this week, moms may have another option, a new FDA-approved drug, Zurzuvae, the first ever pill specifically for postpartum depression. Dr. Deligianitis ran one of the trials and says the pill, taken for 14 days, provides almost immediate relief.
What's it like for you as a clinician to see a woman who came in suffering from perinatal depression, boom, in a couple of days?
Goosebumps. It was a little unreal because we're just not trained in this way to think that our therapies can work so quickly.
The overall price tag on the treatment is around $16,000, and it's unclear at this time if or how much insurance will cover. There are other unknowns as well.
You can't take it if you're breastfeeding?
No, we just don't have data because it's not even out yet. We don't know if there are effects on the baby. In time, we'll have, information to help patients who are lactating make those decisions.
But experts like Joy Burkhardt say it's a reason for hope.
It's a game changer. But what we don't want to overlook is the fact that women still need support. We need the pill, but we need much more.
How perfect is that?
Who's that?
Mitchell Encarnacion likes to share happy memories with his daughter Evie.
It's Mama.
But he's willing to talk about the painful ones too, with the hope that by looking back, he can encourage more women with PPD to come forward.
I didn't think it would happen to me. I didn't think it would happen to somebody that happy. Maybe if people knew, they'd still have their mom. Because now all Evie has is pictures.